Hello students, my name is Ryan Andrews. I'm going to be talking to you about genetics and genomics today. The objectives of this course are to define genetics, define genomics, recognize strategies for integrating genetic and genomic competencies into nursing practice, list 3 categories of genetic disorders and give examples of each, identify and differentiate between different types of genetic tests, identify genetic and genomic resources for continued self-learning and patient teaching. Also remember you're supposed to pre-read prior to taking this course so that you will be well prepared to receive this information. The study of genetics is the study of individual genes and their impact on relatively rare single gene disorders. Genomics is the study of all the genes in the human genome together, including their interaction with each other, the environment, and the influence of other psychosocial and cultural factors. So, genetics deals with individual genes and their impact specifically on different kinds of disease from a molecular level, looking at each individual gene. Genetics deals with looking at the genes, how they interact with each other, cultural influences like what you eat, how you practice religion, where you live demographically. People in the South eat a lot of fatty, greasy foods, so they tend to, how does that factor in with genetics and the molecular level and the cultural things. It looks at it from a holistic approach, looking at all the different multifactorial situations that can influence that. Nurses cannot be expected to know all there is to know about genetics and genomics. They do, however, need to be effective managers of information, including identifying and assessing relevant resources, evaluating content, synthesizing this for their own benefit, and communicating it to patients, relatives, and colleagues. So you don't have to know everything. You need to know where to get it, what relevant resources are usable, and you also need to know how to relay that information to the appropriate people, whether it be your colleagues, the patient, or the family, in understandable terms that they can grasp. As a nurse, you have to understand genetics and genomics can lead to definitive diagnosis and individualized treatment. But you have to have the base knowledge in order to be able to recognize those things that can lead to that. You have to be able to identify patients, identify appropriate treatments, recognize certain labs, know what you need to be looking for. Secondary diagnosis of genetic disorders, at-risk family members can be identified, or carriers. If a patient comes in and you're doing a health assessment, you recognize things that she's telling you that tells you that she is at risk and you need to further look into it. That is what nurses do. You recognize when to implement the information that you know. So you also have to be able to provide support, obtain credible current info, resources, contract support groups, relevant healthcare professionals, and genetic services. You can provide this information to families that are dealing with these different issues. You can be an advocate for them when it comes to their private information. You make sure that the physicians are explaining the things they need to be explaining to them. You're their resource person. So you have to be a credible resource person that knows what you're doing, is competent. You also have to be able to inform and teach and explain some key concepts and dispel any myths and ask questions and determine understanding using layman terms and explain to patients. So you recognize when a patient doesn't really understand. Say a doctor comes in, explains something, they nod their head, then they leave, then you reevaluate to see if there was effective communication going on. Then you help clarify some of the information that was discussed, and you dispel any myths, you give them appropriate resources, and you break it down into layman terms where they can understand it. Geneticists group genetic disorders into 3 categories. You got monogenetic disorders, multifactorial inheritance disorders, and chromosome disorders. Monogenetic disorders are caused by a mutation in a single gene. The mutation may be present on one or both of the chromosomes. One chromosome inherited from each parent. Examples of monogenetic disorders are sickle cell disease, cystic fibrosis, polycystic kidney disease, and Tay-Sachs disease. Monogenetic disorders are relatively rare in comparison with more commonly occurring diseases such as diabetes and heart disease. A major distinction among monogenetic disorders is between dominant and recessive diseases. Dominant diseases are caused by the presence of the disease gene on just one of the two inherited parental chromosomes. In dominant diseases, the chance of a child inheriting the disease is 50%. In a family situation, for example, if parents have 4 children, it may be possible that 2 of those children inherit the disease gene. Examples of dominant diseases are Huntington's disease and Marfan syndrome. Recessive disease require the presence of the disease gene on both of the inherited parental chromosomes. In this case, the chance of a child inheriting a recessive disease is 25%, so 1 out of 4. In the family example, if the parents have 4 children, it may be more likely that only one child will develop the disease. Examples of recessive diseases include cystic fibrosis and Tay-Sachs disease. Multifactorial inheritance disorders are caused by a combination of small inherited variations in genes, often acting together with environmental factors. Heart disease, diabetes, and most cancers are examples of such disorders. Behaviors are also multifactorial, involving multiple genes that are affected by a variety of other factors. Researchers are learning more about the genetic contribution to behavioral disorders such as alcoholism, obesity, mental illness, and Alzheimer's disease. Chromosomal disorders are caused by an excess or deficiency of the genes that are located on chromosomes, or by structural changes within the chromosomes. Down syndrome, for example, is caused by an extra copy of chromosome 21. There are no individual genes on the chromosome is abnormal. There's just an extra copy causing the effects of Down syndrome. Prader-Willi syndrome, on the other hand, is caused by the absence or non-expression of a group of genes on chromosome 15. So there's no abnormality, it's just an absence or a non-expression of a group of genes causing a genetic disease called Prader-Willi syndrome. A specific form of blood cancer, chronic myeloid leukemia, CML, they think it may be caused by chromosomal translocation. That's when a portion of 2 chromosomes are exchanged. In this instance, chromosome 9 and 22 are exchanged. There's nothing wrong with the material, they're just in different places. So no chromosomal material is gained or lost, but a new abnormal gene is formed that leads to formation of cancer. The next thing I want to talk about is genetic testing. There are multiple different kinds of genetic tests, such as diagnostic testing, predictive and presymptomatic genetic testing, carrier testing, prenatal testing, newborn screening, pharmacogenomics testing, and research and genetic testing. Diagnostic testing it tells you about the actual, you already have disease issues and you're trying to find out what's wrong with you. So you go, they do these genetic tests and see if they can find any genetic root to the problem to help you have a definitive diagnosis. Predictive and presymptomatic genetic testing is you have maybe a family history, so you're just trying to find out if you do have something. So you're doing it preemptively. There's nothing that you've experienced yourself that has made you think you have something, but based on maybe family history or the lifestyle, or you just inquisitive and want to know, you can go have your genetic makeup evaluated to see if you have any indicators that put you at risk for a genetic disorder. Carrier testing, that would tell you if you're carrying something Like if you and your wife were thinking about having a baby and you want to see if there's any risk of having a child with some kind of genetic disorder, you could determine that by having carrier testing. Prenatal testing, that's when you have a baby tested prenatally before they're actually born. You can do the amniocentesis, or you can have some blood work done in the mother that can help indicate. Then you have newborn screening, which the child's already born, and right after they're born, they screen them to see if there's anything, any kind of genetic considerations as far as diseases or complications they may endure. Pharmacogenomic testing, that's where they can take and genetically test you to see which medications would be most appropriate for you. Some people have reactions to certain medicines, and some medicines work better for them than other people. This has to do with that. It helps them find the best medicine for you that would be most effective. Research and genetic testing, that's where they use genetic testing to help benefit people long term. You may not have any results that help you individually, but your input and the information that you provide will help the broader group of people collect information to make definitive recognition of different things that influence. There are some things to consider when having genetic testing done. I know a lot of people think, oh, I just want to know, but there are some false positives. When my wife was pregnant, she had our baby prenatally tested positive for trisomy um, 21 or 17 or something like that, and it's a pretty nasty little situation where the baby doesn't normally survive. It really stressed us out, worried her. She was very emotional over it, felt guilty about it. The baby ended up, we had to make a decision collectively to decide, we're just going to embrace this pregnancy, not worry about it, but we, utilizing that information, we'll be prepared, and the OBGYN will be prepared in case there are some complications. So we had saw specialists. I didn't see anything that really indicated there was a problem, so we decided to progress with the pregnancy and just embrace it and enjoy it, and not make it a miserable experience where we're just dreading the loss of this child. Everything ended up being fine. I have a beautiful 3-year-old redhead that is a handful, but the genetic test actually caused us a lot of grief, misery, and it was just a false positive. Other people, they deal with other complications, like they find out they have something, or that they were a carrier for something, and then now their child has it, and then there's guilt associated with it. So there's some other psychological things to consider when dealing with that as a nurse. You have to be able to be ready to support the patient and their family when they encounter these. Pharmacogenomics is the study of the relationship between genetic variations and how our body responds to medicines. This is a relatively new concept where they're using pharmaceutical and genetics and combining it and trying to determine which medication is the best for certain kind of patients. Right now, medicines are kind of a one-size-fits-all, but everybody knows I've taken stuff that seemed to work really good for other people and doesn't seem to work as well for me. If you end up nursing for a little while, you'll realize some people, you can give them a little bit of medicine and it knocks them out. Some people require a lot more, have a higher tolerance. This study kind of determines what the variations and difference in these people are. There are certain genes that can indicate that one medicine would be more effective for someone than someone else. Also, some people have adverse reactions to medications, and this study can help determine those factors. Implications for clinical practice. Family history is the most powerful genomic tool available for any clinician. When you do your history and physical, you need to pay attention to the different things and pick up on things that are prudent and would warrant investigating. And that is part of being, using your clinical judgment based on the assessment findings that you see. But in order to do that, you have to have a sound educational base on genetics and genomics in order to be able to recognize things and also enable to educate patients and evaluate patient understanding. If you don't understand it, how are you going to evaluate it or teach it? You also have to be able to administer drugs based on genotype, recognizing need for genetic services, making referrals to community genetics services or resources. This is some of the more up-and-coming things. Genetics and genomics is becoming a big thing in healthcare, and it's going to be one of the next big things. But it's so rapidly evolving that it's going to require nurses to continually educate themselves. Patient advocacy is also going to be a big thing. It's already a big thing, but when you're dealing with somebody's private information relating to the genetic information, this is going to become a very difficult thing to deal with, because you're going to deal with people that are carriers, and they may have genetic disorders in which they could potentially get with a partner and pass on something. And it's just going to be a very complicated process to deal with the privacy issues related to that. Also, as a nurse, you have to be able to obtain credible current information, resources, contacts, support groups, relevant healthcare professionals, and genetic services. You need to be able to distinguish what information is relevant and is pertinent and credible, and you need to be able to relay that information to patients and be able to identify it yourself. Everybody has an internet nowadays, and they have access to multiple different sources of information. It's your job to dispel any myths that certain patients come across and indicate whether they're utilizing the appropriate resources. Informing and or teaching and explaining some key concepts and dispel any myths. This is where your background education comes in. This field is going to be so large that you really just need the basics so that you can understand if something's more specific to a patient. You need to be able to research it and have enough knowledge about genetics and genomics in order to determine and recognize and understand what you're reading so that you can reciprocate that to the patient. Able to ask questions and determine understanding and use layman terms in order to educate patients. You need to be able to talk to the patients, understand, recognize whether they understand what they're talking about or what they understand as far as if a physician came and discussed something with them. You need to be able to determine whether they really did understand what was told to them. If you're giving them information based on that you just derived some genetic, found out they're a carrier for a specific genetic disorder, and then they say, oh, we're going to have to, terminate the pregnancy, when there's only like a very rare chance that they may pass that on because they both have recessive traits, then you need to re-educate these people. Make sure they understand the risk, and make sure they understand that there's other options to do further testing and so forth. But that you have to have a background knowledge and have enough education in order to decipher that and relay that information. Here are some very useful genetic and genomic websites that can be useful in your nursing practice and your future education.